Street in Cleveland, Texas, owner Brent Harris can help. Shower tile, tub surrounds, even backsplashes. Give them a call today at 817-641-9444. The Floor Store. They got you covered.
You're listening to Joco Community Radio.
Good evening and welcome to the Reach Across Johnson County segment on Joco Community Radio. You can join us live here on Facebook or download the TuneIn Radio app. It's free, where we are live 365 on Joco Community Radio, the voice of Johnson County, Texas. Reach's mission is to support safe and healthy choices vital to the well-being of our youth, families, and community. This show will guide you, educate you, and inspire you to be a part of the solution and to reach out and help make a difference in our communities. What began as a local movement in the city of Midlothian grew to include programs throughout Ellis County within only a few years and eventually expanded into neighboring Johnson County. And here we are today. We're going to give our special guest a few minutes to get logged in. And I did want to send my condolences to the families in Uvalde. It was such a terrible, tragic thing that happened yesterday. So our thoughts and prayers are with their families. Mm-hmm. It was a very emotional evening last night and morning when I actually heard about everything. So any thoughts from you ladies?
Just that, just really, you kind of just hit it. Our hearts go to the kids, the families, the schools. A lot of my family and friends are teachers, and I know that they all have fears that this can happen to them because you just don't know. And I think, we take our loved ones for granted.
We do, don't we?
You're sending your kid off to school. You don't know. You're not thinking that it's just sad. Yeah. It's just really sad. Yeah. It could be that teacher could be your sister, that could be your niece, and you just don't know and you don't expect it.
Well, it hit me this was more emotional for me for some reason, but my daughter is an elementary school teacher.
Yes.
And so that kind of hit me. And then these kids were the ages of my granddaughters. And it was like, if I get to think about too much, I want to get emotional and I don't want to cry, but man, I can't imagine what the families are going through in that host school district and city itself. It's such a sad time for them. Well, I guess I ought to introduce myself. I guess I totally forgot to do that. Well, I'm Shari Phillips. I'm one of the co-hosts this evening for the Reach Across Johnson County Coalition show, and I'll let my co-host introduce themselves.
Hi, my name is Ashley Vasquez, and I am the Reach Across Johnson County Coalition Coordinator.
Hey everyone, this is Emily Stuffelby, and I am the COVID Project Coordinator for Johnson County.
Well, this evening, our topic is going to be, we're going to get an update on the continued harms of vaping. We've got Dr. Devika Rao that's going to be joining us this evening. Dr. Rao received her medical degree from Baylor College of Medicine in Houston in 2006 and completed her pediatric residency at Emory University School of Medicine in Atlanta, Georgia in 2009. She completed her fellowship training in pediatric pulmonology at Boston Children's Hospital in 2012. And she is now an assistant professor of pediatrics at UT Southwestern Medical Center, where she is the medical director of Pulmonary Function Testing Lab. She has seen and treated numerous children for vaping e-cigarette related lung injury at Children's Health in Dallas. And she's published a medical manuscript on the experience in pediatrics in May of 2020. And she was invited by the Center of Disease Control and Prevention to participate in the formulation of a national clinical guidance in the treatment of e-cigarettes related to lung disease in 2019. She has been interviewed by numerous local media outlets regarding her experience in treatment of vaping injuries, as well as by the Washington Post and the Wall Street Journal. She is currently developing several projects related to lung function and outcomes in teens who vape. Welcome this evening, Dr. Rao. We're so happy to have you with us.
Happy to be here. Thank you for having me.
We can hear you. So we had Dr. Rao on with us. Gosh, I guess it's been over a year ago that we had you on and kind of talked about, what y'all were seeing in the vaping and things like that. And so we are so happy to have you back because it is still an issue that our schools are dealing with. We're seeing this in our communities and things like that. And I know that there are some updates. And I know one of the things that came across was the FDA has banned all flavored e-cigarette products. And so I guess our question to you, with them doing this, is this going to help curb youth vaping? And are there any loopholes?
Yeah, so I think that the step that was taken to ban flavored e-cigarette products was a really important one, because we know that flavors are a major reason why teens and adolescents choose to start vaping, along with curiosity, along with being exposed to a family member or a friend who uses e-cigarettes, as rounding out the top 3 reasons why young people choose to start vaping. And there's also a misconception among adolescents that it's safe and safer than using cigarettes, combustible cigarettes. Unfortunately, the ban actually comes with a loophole. It doesn't apply to disposable e-cigarette products. And in the last few years, the popularity of disposable vapes, brands like the Puff Bar, have really increased in popularity. Yes. And young people can purchase these products very easily. They're inexpensive. They can be as low as $10 or $20 per vape. And these come in extremely attractive flavors that are fruit flavored, that kind of enhance the experience. And the products in disposable vapes mirror the technology that Juul used, which really kind of led to a skyrocketing exponential increase in the use of these products by young people. So these are concerning issues that young people seem to find a way to continue to using these e-cigarette products. And in terms of policy, we are still kind of catching up. And so when it comes to these products, I worry that the education of our young people that these products are, maybe less harmful, is going to prevail, and that the continued use of these products will continue to be a problem.
Right. Do you think because they are sometimes still, said to be a safer alternative? I mean, it's kind of like, comparing apples to oranges. I mean, they're two different things, completely. And, everything that we've seen and heard about them, they're not really any safer. I worry about that because I've got a son that, he stopped smoking the combustible cigarettes, but he's vaping. But I mean, it kind of scares me for him as well. So I don't know. Any thoughts from you girls?
I think that if I ever hear or see someone vaping, and if I ask them why, it's always that, like, they think that it does not harm them. They do believe it's safe. Like, I think that is just what most people believe. So that's like a very large myth that everyone seems to believe.
Now, they're not monitored by the FDA as far as anything like that currently, correct? I mean, it's, even though the things have started passing, they're not currently, I mean, when they're like a gap, I guess, before things, I don't know, what do you call it, before measures actually went into effect?
Yeah, so right now there is a ban on flavored products. Okay. And for existing e-cigarette companies to continue to be able to market their products, they have to fill out an application, and the deadline to actually fill out the application so that they can keep their products on the market has passed. And the FDA is in that kind of review process, okay, to determine which products can remain on the market, and which cannot. So we're moving in the right direction in terms of trying to regulate these products and decide, well, the government will decide ultimately which products remain on the market. However, in that time frame, so many millions of young people are becoming addicted to the nicotine and marijuana in these e-cigarette products. And also, recently, I believe in the end of last year, there was a specific e-cigarette. The brand name is escaping me. That was actually approved.
Oh, okay.
And so that kind of also it was disappointing to a lot of us in terms of advocacy against youth using these products, that it sort of is out there that there's an understanding that some of these brands have been actually approved to be on the market. Now they're not approved for the purposes of cessation of combustible cigarettes or addiction to cigarettes.
Yeah.
It's not approved for that particular indication. But these products that have been approved were it was approved by the FDA. So that is kind of a concern.
Now, the Juul, have they been banned from what they're supposed to do, or is Juul still available?
So currently, they are able to market tobacco flavored products.
Okay.
And menthol as well. And so, what the research has found is that if these flavorings, like the mango and the fruit and all of that, if those are not available, then teens readily find that the menthol flavor is appealing. And then some of these tobacco flavors are kind of flavored, like they're like vanilla tobacco or things like that can also be appealing, and can also be appealing for a teen who's previously used flavored products or flavored Juul products, and is very addicted to the nicotine in those products, and then goes on to use a tobacco flavored product.
So what all are kids vaping this day? Is it just nicotine, or are y'all seeing other things?
So it's nicotine, it's flavorings with or without nicotine through these disposable products. And marijuana is also becoming more popular. We did see a peak in rates of e-cigarette use of nicotine and marijuana containing e-cigarette products in 2020. And the rates of both nicotine and marijuana vaping did decline somewhat in 2021. The peak nicotine product use was a little over a quarter of 12th graders were using nicotine containing e-cigarettes. And we also saw in 2020 a peak in the use of marijuana containing products. Now, the methodology of obtaining this data, these are national surveys administered to middle school and high school students across the country that were previously administered in person, like in an in-person survey. And that methodology changed in 2021, where these surveys were actually administered online. And so there's a concern that perhaps the methodology of collecting the data may have affected the results, and we're underestimating the use of e-cigarette products in 2021. And also B, that the decline not only reflects perhaps an increased understanding of the harms of e-cigarettes, which I think may be a very beneficial consequence of the E-Valley outbreak or the severe lung injury outbreak. And so we're kind of awaiting what the 2022 data is going to show. As you know, Shari, I'm working on vaping research in the community and just collaborating with individuals in different school districts in the Dallas area. I'm hearing from school officials that specifically marijuana vaping is increasing in schools. And so this is becoming a real problem. There's not a ton of research about there's not ample research like there is around nicotine containing e-cigarette products in terms of the respiratory harms, but certainly there is more and more research being done about it. The most severe consequence being the e-valley or the e-cigarette vaping injury that led many, many adolescents across the country to require hospitalization.
Right.
But also there's some research that suggests that marijuana vaping is associated with worse wheezing and bronchitic symptoms, or episodes of bronchitis and shortness of breath. So there is some concern that even these products, the marijuana, which teens may perceive to be safer than nicotine-containing products, they may use it more so for mood disorders, anxiety, stress, which is what I hear from patients. But these can have also consequences on the health of young people.
Have you heard how the youth are getting their hands on? Because I'm assuming that it's going to be like the liquid THC. I mean, I don't know if it's something that they can just purchase online from a state or something that may have legalized it. But I mean, I know here in Texas, it could be a felony offense, because of the amount of THC that's in the devices.
Right. I do think that in Texas, my suspicion is the black market is kind of a significant source of these products. And I think that's why we had so many cases of E-Valley in the state where young people were hospitalized from lung injury from vaping. And so I suspect that this was a common source and continues to be a source. When I talk to patients about it, they really say that they get their products from like friends and from dealers. Just recently, there was a press release that I believe the Department of Justice had arrested a black market marijuana vaping cartridge dealer who had supplied cartridges to a local vape shop that's literally across the street from where I practice. And that individual was providing these products to a local vape shop. So I do think that the black market is a significant source. And when we think about advocacy and policy, whereby we can perhaps influence these overall rising rates of vaping, nicotine, and marijuana, perhaps, and specifically marijuana, perhaps the black market, regulating and paying attention to that is going to be an important part of curbing this epidemic of vaping in kids.
I was going to ask you a question too. Would you say that the problem is, the vaping the liquid, or is it from using the device? What were you seeing that do you think was causing some of the issues from the volley, or what is it that you think that was actually triggering that? Is it something from the device, or?
So what the research suggests is that there was a cutting agent that was added to the THC oil, and that this toxin was identified as vitamin E acetate, or VEA. And this is a substance that's clear, it's odorless, it has the same consistency as THC oil, and it was a way for dealers to make more money. They can dilute the quality of their product with something inexpensive. They can make more money. And it was thought that this was the causative toxin because of samples from individuals' lungs who had E-Valley, and they studied the components. And this particular toxin, the VEA, the vitamin E acetate, was present in the samples of those who were hospitalized with E-Valley and were not present in those who were healthy and not hospitalized for E-Valley. And so that was a study that was done by the CDC, and suggestive of it. If you talk amongst experts in E-Valley across the country, both physicians and epidemiologists, PhD experts in this subject, we do have a concern that there's kind of a spectrum in terms of what E-Valley represents. In other words, there's E-Valley that results from the use of marijuana containing cartridges.
Okay.
And then on the spectrum, maybe a phenomenon of E-Valley resulting from nicotine product use.
Okay.
And that the components in those products, it's unclear exactly what can cause, that severe of a lung injury. But we have a lot of primary suspects based on years worth of research that have been done. So we know that there's substances in these products that are cytotoxic to the lungs, that they cause lung cell death. So that's flavorings, that's the carrier substances that carry the products. There's heavy metals, tin, lead, chromium, all of these kinds of heavy metal products. There's benzene, there's, substances akin to things found in pesticides and household detergents and that kind of thing. All of these
are those in the liquid?
Yes.
Oh,
yeah. So
goodness.
it's in the liquid.
Okay.
We think that the heavy metals come from the coil that heats the liquid.
Okay.
So then the coil heats the liquid that produces the aerosol. And this is really important. We've talked about before, but it's not vapor. It's not just like water. Vapor is water in the gas form. Aerosol has particles.
Okay.
So that aerosol has been extensively studied and found to have all of these substances. And these substances have been studied as toxins and found that when you add them to like animal lung cells or human lung cells, that they cause cell death. So we think that it's very plausible that a combination of all of these toxic substances could, over time, and maybe even over not very much time, cause a lot of lung injury.
Goodness. Well, I know that, because we hear from some kids at times, that was the big thing that well, it's just water vapor. And it's like, no, it's actually an aerosol that you're inhaling. So, I think that, there's still a big education piece that, those in prevention are actually doing to get that across. And, we were talking about the vaping of the THC, just making kids even aware that, if they're caught with the THC, that, there could be a felony offense. And I did kind of want to ask you something on that, because I know, that I've talked about the study that you're doing. Have you heard any more on, I know that there's some schools that instead of like punitive action, if kids are caught with vapes and things like that, that they're looking at alternatives as far as trying to help the kids be able to quit. Do you know any more about that just yet, or is still in the early stages? Or
this is something that's really important. From a medical standpoint, from a public health standpoint, I think it behooves us not to treat kids at school who are caught vaping as like perpetrators or criminals, but really to understand the circumstances around them initiating vaping, either marijuana, nicotine, or both. And we have seen that kids with mental health issues, mental health concerns, stress, anxiety are more likely to initiate the use of these products.
Okay.
And we know that they're marketed towards young people. Right. So how can we blame our kids? How can we blame our teens who have practically no frontal lobe, no ability to make good concrete decisions? It's primed for this problem. If you combine the way their physiology is with clever marketing, with, everyone's doing it. I had a patient of mine who, and I tell this story often, I really try and understand from these teens who have been hospitalized with vaping lung injury, how are you getting this? What compels you to do this? And she looks at me and she says, Dr. Rao, in the club, everyone's doing it. And she was this very vibrant, intelligent Latina young lady, a student who's, only 16, 17, 18 years old. And she's in this, in this environment, in this social environment. I'm getting off track a little bit, but to answer your question, it behooves us to treat these kids who are caught vaping as victims, right? And who kids who need our help to get them out of this habit of vaping, which is really addictive. And the American Heart Association actually has a really nice toolkit that encourages school districts to not suspend or expel students who are caught vaping, but to really embrace them in a program of education counseling so that we can help them. And there are school districts in the DFW area that are kind of embracing this approach rather than the, if you're caught, then you gotta serve the time.
Yeah.
Now, when it comes to marijuana vaping, I think that's a whole difficult can of worms because there's a law, right? So I feel very strongly, if we can identify these teens, identify these adolescents early, not punish them, and get them counseling and treatment for their addiction, that would be very beneficial.
Well, I know we're fixing to go to commercial break, so I wanted to kind of throw this at you so you could kind of be thinking about it. We know that coming across, trying to get over a nicotine addiction is extremely hard, but I wanted to find out your thoughts on treatment for the young kids, if there was, if there's anything that's actually available for them. And I'm very intrigued about the not being punished type deal. So I really want to find out more about those schools. That way we can maybe incorporate that into some of our school districts and our communities as well, to give these kids the help that they need versus necessarily punishing them. But I ask everybody to stay tuned. We're going to come back with Dr. Rao after the commercial break. I can't talk. So don't go away. We'll be right back.
Hey, Jill, congratulations on your son getting into the college of his dreams and with a full scholarship, too. Yes, we are so proud of him. I have to be honest. I'm a bit worried about our daughter getting into college. It's so competitive out there, and I feel overwhelmed with where to start. I completely understand. Listen, I felt the same way, and then I met Dr. Gina of Education Prep Centers. She put a plan in place that helped our son stand out in the admissions process, and that gave us a peace of mind for how to create a financial roadmap for his future. Wow, that's great. Sounds like I need to give her a call. Yes, she definitely helped our son find the perfect college, meet all his deadlines, and help us feel less anxious about the whole process. You need to reach out to her. Just check out educationprepcenters.com and set up a complimentary assessment with Dr. Gina. You'll be so glad you did. Education Prep Centers, college admissions made easy.
When you're hungry for tender brisket or some delicious homemade cobbler, then look no further than Leach Brothers Barbecue, located at 1106 East Henderson, Cleburne, Texas. Leach Brothers has been family owned and operated since 1950. Take it from me, Taco Joe Orwinski. Todd and his family have been filling my belly breakfast, lunch, and dinner for a long time. Heck, I even have my own booth, open Monday through Saturday, 6 a.m. to 7 p.m. Come see them for dine-in, carry-out, and all your catering needs.
Hey, there's something you forgot to do. It sure is hot. Are you sweating like a dog? Wait, what? Dogs don't sweat. Oh no, you forgot to get your window tinted. Whether it's the kitchen window that sits in the sun for the hottest part of the day, or you just got new wheels, call Sharp Window Tinting in Burleson. 817-615-9379, or look them up on the web, sharpwindowtint.com.
You're listening to JoCo Community Radio.
And welcome back to the second half of JoCo Community Radio and the Reach Across Johnson County segment. JoCo Community Radio is proud to be the voice of Johnson County, Texas, and is live 365 on TuneIn Radio Network. To listen or watch, simply go to tuneinjoco.com to choose where and how. The Joco Community Radio app is now available for free on Android and Apple devices. Simply search your store. Check out our lineup and more on jococommunityradio.com. This episode and more is brought to you by Patriot Claims, making your insurance work for you. Reach out to your Texas sales rep, Nona Reed, at 844.tex.hail. That's 844-839-4245. Thank you, Nona, for being a sponsor for our show. And if you're just now tuning in, we have Dr. Davika Rao that has joined us this evening. And we've been talking about vaping, and she's kind of been giving us an update on the continued harms vaping, especially with our teens. And before we went to commercial break, I'd asked about the possibilities or what might be available now for treatment, because I know early on, as far as like nicotine replacement type stuff, those were geared for young people. And I just wondered, since we talked to you last, has anything changed as far as helping the kids that are struggling?
Yeah, this is something I'm really interested in learning how to do and addressing at my place of practice, is treating young people for nicotine addiction, specifically from vaping. Some of my colleagues in pediatric pulmonology across the country, they do actively treat young people for that type of addiction. And actually, I'm trying to learn how to do that so I can prescribe these types of products for these types of medications for my patients as well. But there's actually 7 FDA approved methods for treating nicotine addiction. And some of my colleagues are using these medications, using nicotine replacement therapy patches for their patients, and having success in treating young people's nicotine addiction.
So the methods that they're using were actually geared for adults, but it's being monitored and being successful then with the young people?
Right. That's exactly what I hear. Now, unfortunately, this is not really been studied very well in young people, and so these medications are not approved for this age. But this problem sort of sprang upon us kind of unexpectedly. Starting in 2017, we saw a rise in e-cigarette products, and the popularity of them. Like the curve is just, if you look at the graph,
it went way up, though, didn't it? Well, I know, because it seemed like we ended one school year, with other things, and it's like boom, the next school year. I mean, we were being contacted, what do you know about vaping, and what can be done, and it's like, oh my gosh, and it's like, we try to reach out to many of our resources that are available, and it was like it caught us all unaware that that the kids were going to get hung on this stuff, and it's really scary. I know that we were talking earlier that some kids, they're using the nicotine devices, they're thinking that it helps them with their stress and stuff like that. And I hear that even with my son who vapes. Of course, he's in his 30s. He said that, it helps him to calm down. And it's like, but it seems like you're doing it a little bit more often, or, so I'm always trying to shoot stuff. He kind of rolls his eyes at me and everything. And it's like, Mom, you're making it worse. So it's like, I try not to do too much, but anytime I hear something that's, that's detrimental to health of the people that vape, it really scares me, because we don't know what the maybe the long-term effect of vaping is going to be for some people. I mean, it took us a long time to even find out, what cigarettes, what they were capable of doing to lungs and even other organs in the body. So it is a little scary.
Yeah, for sure. I think those are really good points. We don't have data. We don't have longitudinal studies. We don't have decades of longitudinal studies looking at the long-term side effects of e-cigarette products. Anecdotally, we see kids coming in with worse asthma, bronchitic symptoms, more wheezing. We see kids who are struggling with sports performance or struggling to pay attention in the classroom because they constantly need that dopamine rush from their vapes, which they're addicted to. So this is a problem that's really kind of sprung upon us, and continues to be an issue. And it was like the thing right before COVID hit, and then very reasonably, COVID kind of has preoccupied all of our minds. And what I'm theorizing is that now that kids have been back in school for a while, and especially with some of the stressors of the pandemic, of limiting, social circles and experiencing loved ones, fall ill or even pass away from COVID, from experiencing a lag in education, perhaps for various reasons, experiencing, adults in the home lose their employment, struggle to survive with economic factors, that these cheap, available, fruity products are going to make and are making a comeback.
Yeah, absolutely.
I had a thought, and this might seem
Get closer to your mic.
Sorry. I had a thought, and this might seem like really, really simple, and it's not based on any science whatsoever. But I guess whenever I see a vape, and I was telling Shari, it reminds me of an inhaler. And so for those who have asthma and they're like, I can't breathe, and they do the inhaler and they feel better. And it just made me, as you're talking about stress, it made me think of one of the really simple strategies is take a deep breath.
Yeah.
And just keep taking a deep breath. And so my mind is just is that, tied in with all of the products that they're putting inside of it. But I'm wondering if that's part of that that addiction process of, it's relieving my stress. It's really it's that process of taking a deep breath. But does that make sense?
Yes.
I hope it does.
It does.
I think so. The hormone kind of responsible for that feeling of pleasure is dopamine. And whenever we do something that we derive some satisfaction from, which actually includes scrolling on, social media, we get that dopamine hit. And young people are primed, their physiology is primed to really rev up that cycle and that response to dopamine. They're more vulnerable to developing an addiction. And so I think that's why we see teens addicted to things like, vaping and social media and electronics. And, that's why adults, we're all addicted to our phones as well, is because of that dopamine response. When it comes to that breathing sensation, that's something that's really interesting and that I hadn't really thought about. Perhaps there is some sort of additional benefit perceived with that breath, with inhaling, along with that flavor and that experience. That kind of reminds me of the advertisements of cool people smoking. It's that kind of image. It's the whole experience that is extremely appealing to young people. And it's everywhere. It's everywhere. There was a recent story just earlier this week of a very famous pop star whose name escapes me at the moment. And she couldn't perform. She had to cancel her concert at the last minute because she had to have throat surgery done because of complications of vaping.
Oh, wow.
There's a very famous comedian, Dave Chappelle, who, some time ago, I think I was watching his special, and he couldn't go more than 45 seconds without pulling his vape out and taking a hit. And I think he replaced, during that show, he replaced his device 2 or 3 times during the show.
Oh my!
And
word.
I was just I don't know how I got through watching that. I may have walked out.
How does someone not get nicotine poisoning from that, though? I mean, I guess I'm not familiar enough with it, but I would think that that's just so much nicotine getting, into the your body. Because you know, I've heard that those devices, I mean, if he's having to change out the cartridge or whatever, I mean, that's equivalent to like 24 cigarettes.
Yeah, it can be a pack of cigarettes. Exactly. And depending on the product and depending on the concentration. So that's the difference is, you know, you kind of like know what you're getting in a pack of cigarettes.
Right.
When it comes to a vaping device, because of the, you know, really the lack of regulation, now we're trying to move towards like, okay, you know, the companies have to fess up and they have to really declare what substances are in their products. But that doesn't exist right now. They can just kind of say, oh, this has this many, you know, this many micrograms of nicotine or this many, you know, whatever the substances are.
So so you said that the deadline for people to turn in to submit their products that's passed. Do you know how long typically it takes for something like that? I mean, because I know, you know, with it not being regulated, and we're hoping this is going to be something that's regulated. How long does it normally take before the process actually goes into effect? Do you know?
So I think that's a hard question to answer because I think the FDA is just really is overwhelmed with the pandemic. And I don't know what kind of resources they have to be able to review all of these like hundreds of applications to keep products on the market. And so I serve on the advocacy committee for the pediatric section of the American Thoracic Society, which a lot of pretty much all pediatric pulmonologists are a part of. And we discuss advocacy issues when it comes to young people and lungs with liaisons that work with various branches of the federal government. And my understanding is that they're kind of nearing to the end of the process of reviewing these applications to determine which products will be able to remain on the market. And so then it's going to be a matter of enforcing this issue. So, you know, we know that, you know, you can't sell in the state of Texas, you cannot sell nicotine to a minor. We know that it still happens. So it's really going to be a matter of regulation.
Okay. Well, that's kind of, well, at least there might be an end to it at some point, maybe in the near future and everything, to where maybe it can help. When you talk about advocacy and things like that, is there things that community members, you know, like our coalitions and stuff, that we can do to help on things like that?
I think that the key is prevention.
Okay.
When it comes to anything, you know, and I'm reminded of the horrific events of yesterday that happened in our state. The key is prevention.
Yes.
What can we do to prevent a young person as young as 10 from being attracted by this particular product? Well, what we did with other drugs and what we did with cigarettes really worked. You know, we had DARE, we had all of these education programs in elementary school, educating kids on the harms of drugs and cigarettes. And it works.
Yes.
When we empower young people with knowledge, kids are smart and they know what's beneficial and what's not. When they're taught these things by adults, by teachers, by people in the community like yourselves. So we need a major public health campaign, messaging campaign that young people are still using e-cigarettes, that we are mounting evidence by the day that these products are harmful. We know that young people are primed to become addicted because of that dopamine response. And let's talk to our kids about this as young as elementary school so they're aware. That is the most important thing. And let's have conversations at the dinner table. Let's have conversations in our community that these products are harmful. That's number one. And then alongside of that, is policy, which tends to lag behind the science, and that's something that we can influence. We can talk to our elected officials. We can talk to our school districts. We can, request that counseling be provided through programs like, the American Heart Association Toolkit, so that young people, when they get caught, that they're given the resources necessary to provide counseling and to provide cessation counseling as well. And I know that that's where you all come in.
I know we all have our work cut out for us, don't we? It seems like just when we think that we're tackling one thing or getting our hands, getting it maybe a little bit under control, something else happens. So we're always kind of having to wait for the other shoe to fall at times. But
well, I also think that this really emphasizes the importance of public health. What lessons can we learn from COVID? I think we can learn that public health is absolutely necessary to keep our population safe and healthy. And I think we can learn the same lesson from the vaping epidemic, that let's put our resources into prevention. And that means supporting public health departments. That means making sure that public health officials and epidemiologists have a seat at the table, that these particular research projects and scholarship are really, really worthy of funding. These are, and right now we're seeing that kind of that fight for public health funding when it comes to COVID, something that I just never thought would be a problem, but is a problem. And we're seeing cases rise again. I'm seeing so many cases in my own community. And so public health is really, I think, where we need to put our efforts.
Yes. Well, we talk a lot of times, public health, mental health focus, which, we're really happy that even our grant funding now is kind of leaning towards that, to where it's incorporating more on regarding mental health around things. And so I think that's good. I know you wanted to, no. Okay. All right. So I want to go to we do have a few more questions that we did want to ask before we run out of time. What would you say that we've learned as a result of the EVALI pandemic, or epidemic rather, not pandemic, epidemic?
Yeah, the EVALI outbreak. So as of February 2020, I'm losing my years. The last few years have been a blur.
I know.
Like, what year are we in? So as of February 2020, there were over 2,800 reported cases of EVALI across the country. 15% of those happened in less than 18-year-olds. So we've talked a lot about what the perfect storm was. So we had increasing rates of e-cigarette usage amongst young people that was really exponential in growth. We had a lack of federal regulation on these products. We didn't know what was in these products, and that really led to this perfect storm. I attended a talk at our recent American Thoracic Society meeting, and it was discussed that that hookah, actually, the acceptance of that among young people, which is actually flavored tobacco, and it's something fun that you do with your friends in a social setting, kind of paved the way for young people to think that flavored tobacco in an e-cigarette was fun and was harmless. And then we've also talked here about the kind of black market, and that this was likely a significant source of these altered products that were associated with EVALI. So in kind of thinking about what were the factors that led to EVALI, I think is where we can learn our lesson, which is prevention is worth. It's like gold. That we need to improve our public health messaging. We need to reach our young people and tell them about the harms. We may need to regulate this black market as a significant source of products that may make e-cigarette products even more harmful and more severe in terms of effects on the lungs. And we need to understand that our messaging of less harmful may have contributed as well to young people having these complications. So I think there's many lessons to be learned.
Uh-oh, did we? She might have froze. Okay, we'll hold on just a minute, Dr. Rao. We may have lost you there for a minute. We've lost our sound with Dr. Rao. I'm finding so much stuff that she's told us this evening so interesting. I've kind of scribbled all over my notes. I've got all kinds of notes I need to go back and look at.
For sure.
Yeah, I had never heard of E-Valley until today.
Me
Oh,
either.
really?
Yeah. No, I've never heard of it.
Okay, she may have gone out. Up there she is. She's back.
Sorry about that.
That's okay. It's surprising that it doesn't happen actually more often. I heard something here recently that I don't know if it has something to do with how the planets are aligned, but anyhow, how it has an effect on our technology devices here lately. And I thought, oh, I'm seeing it because I'm constantly having problems with my car and my phone and everything my phone in my car and my computer at home. So maybe there's something to it. But anyhow, do you remember?
I did want to mention really quick that E-Valley is still happening across the country. And at our institution, we saw more cases of E-Valley during the pandemic compared to before the pandemic.
Oh my goodness. That's scary. That is so scary. I was going to ask you something about that with the patients that you see. Do they tell you what their number one reason is for maybe picking up vaping?
So the kids I've talked to, it sounds like curiosity is a huge part of it, and the social aspect of it and the flavors. So what they tell me is kind of aligned with what the research shows.
Okay.
That they're attracted to the flavors, they're curious. And then what I do uncover in terms of E-Valley especially is that these young people have a lot of stressors.
Yes.
I've had patients who have had to go through rehab for alcohol abuse, like an adolescent, kids who have lost loved ones, had deaths in the family, just a lot of kind of crazy amounts of psychosocial stressors.
Right.
I think that makes the marijuana vaping especially attractive.
Yeah, I bet it does too. So what do you think are some things that you want to let young people and parents know about vaping? I know we've got about 3 minutes left, so I wanted to make sure that you had an opportunity to, now that you've got the sound, go ahead and let parents know what you think, and even the youth.
So I really want to stress to parents, start the conversation with your kids and start it early, and as early as 8, 9, 10. And start the conversation with, do you know about these products? Have you heard of vaping? What do you know about it? Here's what I know. I know that this is harmful and it's not good for your lungs. It's not good for your breathing. And that there's toxins, there's bad things in these products that can be harmful to you. So that's number one. Number two, if you do happen to find that your son or daughter is vaping, to take the advice of a medical professional, and also to think of your child as really a victim in all of this.
Right.
And really to understand the large forces at play that kind of have led to that particular moment. I would encourage parents to start conversations with their school officials. What's happening in their schools, what's being done about this, what educational programs can we embrace through the American Lung Association, the American Heart Association, the Truth Initiative. These are all great resources and have really great toolkits. Catch My Breath is an amazing program that stresses education on so many things, including e-cigarettes, that school districts can embrace. And then, yeah, I guess those are the main things that I want, parents and teachers and caregivers to know. In terms of kids, if there's kids listening out there, if you're addicted to vaping, we can help you stop. There are free text messaging programs from the Truth Initiative. You can go to Truth Initiative. I think it's truthinitiative.org. You can Google it. You can subscribe to the text messaging service. You can find someone that you feel confident, that you feel comfortable, I should say, speaking with, preferably an adult, and say that you want to stop. Some of the research suggests that teens who are vaping, they do want to quit, but they just don't know how. Yeah. And unfortunately, we have some catching up to do in the field of pediatrics in terms of nicotine treatment, nicotine addiction treatment. But that's a good place to start, is seeing a medical professional.
Absolutely. Thank you, Dr. Rao, so very much. Thank y'all for tuning in this evening.
From Burleson to Venus and Grandview to Godley, this is the voice of Johnson County, JOCO Community Radio.
Let's be honest.